With the methylene blue, there is an activity dependency specificity that where you have increasing energy demand, there you're going to have more accumulation.
Welcome to the Evolving Past Alzheimer's podcast, where we are focused on bringing you information to help prevent from developing and improve from suffering with brain diseases like Alzheimer's and other dementias. I'm Dr. Nate Bergman, a physician and Chief Scientific Wellness Officer at Kemper Cognitive Wellness, and I'll be your guide on these sound waves. So whether you're a baby boomer who's worried that your brain wiring just isn't working like it once was, or you have a loved one with the disease, or you yourself have already been diagnosed and are wondering, what do I do now? You'll want to listen to this podcast. Each episode, we introduce you to the top doers and thinkers that are revisioning Alzheimer's, dementia, and just generally things in life's second half. If you have questions or comments, check us out on social media. To support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show if you find these episodes valuable. That's Patreon, Patreon, patreon.com/evolvingpast. So here we go. Let's get better. If we could transition to another topic away from what we've talked about so far in terms of brain energetics and assessment of brain energetics and lasers, lights, and photobiomodulation, to something that's really quite an old drug, methylene blue, as a potential therapy in Alzheimer's. Can you tell us just a brief bit about methylene blue and why you have been quoted to say that it has sort of magical properties? What is methylene? Kind of give us the brief
Yes.
overview of methylene blue.
Well, I wasn't the one who came up with that. That was Paul Ehrlich uh,
Yeah,
in the
a
1800s
long time ago. Yeah.
when he injected methylene blue to a live rat systemically. And then he anesthetized, killed the rat, and he realized that the methylene blue primarily was taken up by nervous tissue. So he could see the various tissues and he injected a large amount, have some degree of this. This is a blue dye, but the nervous tissue was selectively stained. And in fact, later on, we know if we seen the nervous tissue, what is primarily stained is the mitochondria. So when you give it systemically, it finds its way to the nervous tissue that is the richest one in mitochondria and inside the mitochondria. And it becomes part of the matrix of the mitochondria, the insides of the mitochondria. And there is next to the so-called electron transport complexes that we mentioned before, and as the low concentrations are coming in from the systemic circulation, the methylene blue has this unique property that it starts auto-oxidizing. What that means is that is all the time donating electrons. But what's happening is, in terms of the molar amount, the overall concentration of the methylene blue, some of it is in the oxidized form, which is the one that is blue, and some of it is in the reduced form, also called leucomethylene blue, which is essentially transparent. And so, as a function of time, if it can grab electrons from the media, like the matrix of mitochondria, donate that to a readily available system that
Mhm.
will take the electrons, like the electron transport that is specialized for that, then eventually reaches an equilibrium where you have the same amount of reduced and oxidized methylene blue. When that equilibrium is reached, and in the process of getting there, it is stimulating that electron transport by uh, so in a way, methylene blue during that initial phase is acting as any other electron donor, our natural electron donors like NADH, being uh, NADH and FADH being the most important ones in our brains. And so methylene blue
Compound.
is just acting as another one. And of course, the problem with this is that after it reaches that equilibrium, that's like a peak, then acceleration of electron transport that methylene blue is sending throughout the electron transport, whichever place in the electron transport there is room for an electron to be accepted in these redox cycles, the electron will get there. However, it is known that this happens primarily at the level of complex 4 and complex, and then followed by complex 2. So where normally the FDA donation happens, the secondary type of electron donor. So at these lower concentrations, it's accelerating electron transport, which means those electrons eventually are taken out by oxygen. So it's allowing oxygen consumption and coupled with oxidative phosphorylation and energy production, but through a different mechanism than in the case of the light that was directly uh, donating photons. Photons are similar to electrons, but they don't even have the small weight that the electrons have, but they can photo oxidize cytochrome oxidase. In other words, they can push the electrons out to oxygen. And methylene blue does that as it reaches this equilibrium. And we say this is an stoichiometric. Stoichiometric means just there's no net gain of electrons because it donates one and picks up one from the surrounding media. But it reaches a point where then the electron transport can no longer accept these electrons. So methylene blue, as it increases its concentration, it become that where you have more oxidized relative to reduce, then it's going to start drawing electrons away from the electron transport. And so the opposite effect is going to happen. It's going to slow down then electron
Mhm.
flow through the electron transport. And finally, there will be and so this doesn't mean it's harmful at that point because it may just bring this back to the baseline or control level
So
from
some is good, too much. When I say good, I mean some has an effect.
no
Right.
too much becomes ineffective because then the electron transport cannot take more of this, and methylene blue in now in this we refer to this opposite response in which is facilitating the electron transport and the oxygen consumption in the first half of that concentration range, and in the next half of the concentration range is interfering with oxygenation and the electron transport as being a biphasic hormetic dose response. In other words, not a response that is linear in one direction, but a response that goes up and goes down. So it starts out at baseline, goes up to a peak, and then goes back down to baseline. But if you continue to increase the concentration of methylene blue, then you go below baseline because now, in this case, methylene blue starts grabbing electrons not just from the electron transport, but directly uh, donating them to oxygen. So it competes with oxygen, it competes with cytochrome oxidase for the donation of electrons to oxygen. So oxygen can be reduced. And when it does that, then you're still consuming oxygen, but now that consumption of oxygen is not coupled with oxidative phosphorylation that produces energy. So the high doses of methylene blue are toxic.
If I
They
may, like to try to again to make it simple. I always find it's easier for me to understand something simply and then gather the complexity than it is to jump right into the complexity. the idea that a U-shaped curve or a something like that, where in science, where some is good, and then at a certain point, too much becomes ineffective or bad, or harmful, I think is probably a more accurate way to say it. That's what I'm gathering from you in terms of methylene blue, right? Like there's a certain amount that's going to be effective.
I would not say or ineffective or bad. It's and. In other words, it goes up in a beneficial way, then it starts going back to baseline. So it's ineffective, it's not benefiting, but it's not detrimental. And then goes below baseline. And it's a phenomenon that is well characterized. We have characterized that not only at chemically, looking at these enzymes, measuring oxygen consumption, measuring cytochrome oxidase activity. We also characterize this at the physiological and behavioral levels, and we can see that those response following that initial benefit, and then some intermediate doses, you reach a peak, and then you start becoming ineffective, and then after that you get the opposite response. It becomes detrimental.
So let's talk
uh,
about that a little bit. So, like shortly before our interview, I took 4 milligrams of a product called Simply Methylene Blue by Health Natura. The reason I chose that is because, it was recommended by a group of colleagues, and one of my colleagues he's a physician, psychiatrist, and treats a lot of people for a long time now with a lot of experience. And he did an independent quality analysis for toxicants, particularly heavy metals like mercury and lead, which I learned from you can be a problem
mhm.
with contamination. So I took it, and so what do people feel? What are people supposed to feel like at how on methylene blue? Like, what have you guys noticed in terms of studies? What have you been hearing from study participants? How does it make them feel?
So you took 4 milligrams total or 4 milligrams per kilogram?
I just took 4 milligrams total because there's
Yes,
but yeah, absolutely. Let's talk about the dosing and what it feels like.
yes. The I would say with that, that is a small amount. So I think within the first hour, you may, I don't know, subjectively, I have taken it many times, and I've taken much greater amount of that.
Like how much? I took 4 grams. How much did you take?
I had taken up to 200 milligrams of methylene blue.
And would that still
And
be on the good side of the
yes,
dose that you're talking about?
yes.
Okay, before.
It's still is in the beneficial, the ascending linear function, where you are reaching that equilibrium between the oxidized and the reduced methylene blue inside uh, mitochondria, next to that electron transport. And we know this from so-called pharmacokinetic studies that have been done in animals, but in humans. In humans, you can you can do some of it. In other words, you can detect the amounts of this in blood, and you can detect the amounts that are excreted. It is nearly all excreted through the urine, methylene blue,
Yeah,
and there is very little, if any, metabolism to the parent compound. In other words, the same methylene blue that you take is the same one that is excreted. The half life in humans, and those studies were done with a 100 milligram total amount,
yeah.
is usually 11 and a half to 12 and a half hours for a half life. Half of the amount of methylene blue ingested as is lost in the urine by that time.
So
And,
again, to clarify here, the let's say for because I know we can get deep in the weeds on pharmacology, and I mean I've heard you really with you have a very specific depth of knowledge that it's actually it's amazing. And sort of when we bring it into the practical foray, like for people that are thinking,
Mhm.
okay, well, is this going to be useful to me? I've heard doses, let's say for chronic use, meaning for longer term use, um, around zero point 0.5 to 1 milligram per kilogram. Is that an accurate statement?
Hmm.
So just for listeners' sake, just to give them a sense, because a lot of us are not used to the milligrams versus kilograms. That we think about it pounds. Like if you had a 150 pound person, that's about 70 kilograms, and
Hmm.
that's going to be somewhere between
Correct.
um, uh, 35 and 70 milligrams per day. Do I have that accurate?
Yeah, that would work. But let me tell you, there is a very large safety margin here that is at least two orders of magnitude. In other words, between zero point 0.1 milligrams to 100 milligrams. It's still you are in that linear range where you are getting closer to that equilibrium. In other words, where methylene blue is donating to the electron transport. And the electron transport then is increasing your oxygen consumption and your energy production.
And so one thing
And
though, Francisco, that I noticed though is when I push the dose above, because it's not the first time I've taken it, when I push the dose above, 10, 20 milligrams, it's my urine starts to burn. It starts to be, obviously it changes colors to blue, and that's something everybody should be warned about. But it definitely
yes,
is burning urination.
yes, yes, I have taken many of these doses, and one of the issues is because when we are excreting it, it builds up in the urinary bladder, and the more it is in the urinary bladder, in the mucosa there, all of that concentration now is on the surface there, and at that point is not in an environment like in when you were inside the mitochondria. He could exchange those electrons
Yeah.
with the electron transport. There, what it does, it becomes a pro-oxidant. So the irritation that you experience is the methylene blue is becoming a pro-oxidant on the mucosa
Yeah.
of the urinary tract. And what is the advantage? That's the disadvantage. That can be easily fixed. I can tell you there are compounds that are over the counter that you can take for urinary discomfort
Mhm.
that will immediately relieve that. And especially in my experience, and we done clinical trials, at least three different uh, series of clinical trials with humans. They if they experience this at all, it goes away after the first time around. And however, in order to make comfortable people, we also give them a pill of this. I think it's called an azo dye. I can't remember the
Mhm.
azo, AZO. It's when you take that azo dye, it's over the counter for inflammation of urinary tract, or for, they call it,
Yeah.
discomfort of the urinary tract. Your urine becomes orange or brown. Is a dye, so we actually use it for placebo purposes. In other words, if you take one of those pills together with the methylene blue, everybody, the ones that are getting the placebo and the ones that are getting the methylene blue, they all have a dark urine, a darker urine. So they cannot tell which one, and the scientists, we can't tell which one is taking which. So this is something that can be resolved. But what is that's the disadvantage. The advantage is when it concentrates and it becomes a pro-oxidant there, when it's not in that cycling environment of the inner uh, mitochondria, it it kills microorganisms through oxidative damage, because it starts oxidizing compounds that are present. Any compound that is willing to take its electrons, uh, they're gonna give it to them, and uh, then, especially to oxygen, if it is present there. in any degree. And then,
Hmm.
however, the oxygen will not be fully reduced. So it will generate this so-called reactive oxygen species in
Yeah, like
the
bullies. I think
environment.
about those as bullies for the cells. They hurt stuff.
And
These
then
reactive.
that increases oxidative stress and oxidative damage that follows. So it was used for decades in the United States and most places in the world as an agent to combat urinary tract infections,
Yeah.
especially before the advent of antibiotics.
Yeah.
And the reason is that it increases its concentration inside uh, the
It bullies the bacteria. It bullies the bacteria around, right? Just
the bacteria and the viruses.
yeah, and the viruses.
In
That's a good
fact,
point.
people may not know, but methylene blue is injected to the blood that individuals donate before a blood transfusion is done.
I
And
didn't know that. Yeah.
yes, and the main reason is to kill hepatitis virus, HIV
Yeah.
virus, uh, and the way they can potentiate that effect of methylene blue, this killing effect of by becoming a pro-oxidant, and is uh, if you now provide a bright light. Let's say you take your blood for transfusion, and then you add a very small amount of methylene blue. Now you shine light. It doesn't matter what light. Methylene blue has a broad range of absorption, but of course it works better in the reds because that's why it's blue, because it absorbs more in the reds and the infrareds than in the blues. Uh,
Hmm.
then this is called photosensitizer effect. The methylene blue will become a photosensitizer that will become a more effective pro-oxidant, and then it will kill the bacteria and the viruses present there in a non-specific way by these reactive oxygen species. And that is done. So everybody who
So
gets a blood transfusion gets a small amount of methylene blue. Uh, this is under the hood. And also, dermatologists like it for what is called dynamic or photodynamic therapy for skin cancers. So, if you have a melanoma or other form of a skin cancer, you can put a very small amount of subcutaneous or intradermal methylene blue and shine light to it. And again, you will have those reactive oxygen species destroy those cells in that local area where the methylene blue was deposited. So, in a fairly non-invasive way, you can then remove or get rid of uh, those cells. So, methylene blue has a lot of applications
absolutely.
because
Let me ask you. I want to ask a follow up question, if it's okay, if it's okay, just in terms of what people like feel when they're on it. You know what I'm saying? How do people? What do people tell you they feel, or what do you? You know what I'm saying? Like, what's the experience like on methylene blue? I mean,
in,
I can share my own, but I'm
in
curious.
most people with the low doses that we use, there is no difference between the placebo and the methylene blue. Remember, when people start seeing the urine to this color, especially when we have these active placebos, uh, they always are more likely to come up with some subjective uh, sensations. But
Yes.
uh, I have to say, if you give it to people and do uh, tests for negative and positive affect that we have done, you will see that people there will be mild antidepressant action by depressant.
Hmm.
Why? One of the reasons, one of the components of negative affect or depression per se is is a lower energy production. Or by facilitating
Yes.
mitochondrial respiration and energy production, you are antagonizing one of the consequences or components that is linked in the constellation of things that happen with depression. And there are studies in the 60s done with both bipolar depression or so-called manic depressive disorder and unipolar depression or so-called major depressive uh, syndrome. And in both cases, small amounts of methylene blue have antidepressant effects. The, there's probably more than one reason for this. I just focus on that redox uh, phenomenon that makes it unique, but there are other effects. Methylene blue will exchange electrons in with any tissue oxidase anywhere where you have a redox enzyme that is operating. Uh, it just happens that the most efficient system for that is the mitochondrial electron transport. So that's where methylene blue becomes accumulated.
So is
Uh,
this is then sort of the reason that we would think about it as an application in Alzheimer's, for the reasons that you mentioned previously, which is, essentially, again, I realize this is an oversimplification, but it's like supercharging oxygen, which is a piece of the puzzle here in terms of what is going wrong in a
mm,
diseased brain, right? Particularly in an early case, I would imagine. Once, like you mentioned before, atrophy or areas are truly dead, I'd imagine there's not much advantage in a methylene blue. But from an early
mhm.
intervention, and possibly, I wonder about a prevention standpoint, it seems like there, just at least for the mechanism wise, and the safety data seems pretty good. There's a role for this.
Yes, Nate, you're right on target there. And the animal studies really support this. In and the remarkable thing is you're just making the machinery of the electron transport coupled with oxidative phosphorylation more efficient by having an additional electron donor there. And these can have all kinds of multiple benefit because we use then these new resources to make up for the other ones that have declined. And also, if in experimental situations with animals, we directly tested this, for example, by ligating the internal carotid arteries in animal model, lowering the blood supply to the brain, and then testing the animals, seeing that the animals developed the first thing that they seem to show are memory deficit and especially memory retrieval deficit. And the reason for this is
Mhm.
that this process of memory formation and retrieval involve the network interactions between a number of regions throughout the brain. They're not very focal, contrary to what some people may tell.
Which regions? I'm curious. I would think frontal, temporal, and maybe, like you mentioned before, some of the posterior, like so the parietal area. Which regions actually are involved? Those are my.
Well,
That's what I would
if
guess.
we're talking about the working memory tasks,
Yeah,
there
frontal.
is
Yeah.
a so-called lateral frontoparietal network that is often referred to also as the central executive network that
Yeah,
is
sure.
primarily it starts out in frontopolar cortex, but then you have the dorsolateral prefrontal cortex and the posterior parietal cortex being the main hubs of the network. So it is sometimes
Yes.
also just called lateral frontoparietal network.
Did you find that the methylene blue, at least in the animals, affected what you're describing, the sort of the central executive network?
Well, let me tell you what happens. Methylene blue will exchange electrons with whatever mitochondria are more
Uh-huh.
active. In other words, it is activity dependent. So if you have someone engaged in an activational task that is, let's say, a working memory task, Well, those networks are going to be where most methylene blue is going to end up. So, in other words, mitochondria that are not being demanded more energy production are not going to benefit from having methylene blue around. They're not going to accumulate methylene blue inside. It's only when the mitochondria are demanded for more energy because of neuronal use of
Yeah.
energy during the task that the methylene blue will concentrate there and will provide that extra level of electron donation that will maintain and meet that demand. So it will go where essentially where it's needed, which is something that of course we cannot do with the laser light. We are limited to stimulate some part of the brain, especially this frontal part. With the methylene blue there is an activity dependency specificity that where you have increasing energy demand, there you're going to have more accumulation of methylene blue. So it is a functional stain from that point of view. And in fact, if the animal that you inject methylene blue is dead, methylene blue is not going to stain the nervous tissue. The animal has to be alive and respiring, breathing, and then it will go to those respiring mitochondria and it will accumulate in greater proportions to the ones that are more. So if you give it under resting conditions, then it will end up in this so-called resting state
Oh, yeah.
default mode network that is different from the one that I just described.
Works in opposition sometimes to that central executive network.
Yes, well, that one is more of a medial network. In other words, starts out in the medial prefrontal, and
Yeah.
the other major hub is the posterior cingulate cortex.
Yeah.
This default mode network becomes active when we're not engaged in a task, like a cognitive
Yeah.
task, but it's necessary to consolidate the memories from the experiences that we have. And we know from functional neuroimaging of Alzheimer's and other types of dementia that this default mode network is downregulated during resting state. It's a biomarker of a demented brain. In other words, the individuals with dementia, after
Have
they are not longer exposed to the experiences, the stimulation, the task, they're supposed to be processing that and activating these medial, prefrontal, posterior cingulate regions, but they're not to the same degree as healthy controls. So if you have methylene blue on board at that time, and we've done this in animals, not humans, you can see that increase happening in that resting state default mode network. Uh, we did in humans on the resting state, but they were not subjected. Well, we published the first neuroimaging studies using fMRI and methylene blue in humans, and there we show so-called functional connectivity and cerebral rates of blood flow can be improved by methylene blue administration. And we also measure working memory, vigilance, sustained attention tasks, and can show also improvement after a single acute administration under placebo control conditions. So this is something that
Hmm.
just unfortunately, let me tell you what the unfortunately part is. Methylene blue, as we've discussed, because of its hormetic responses, can do different things and entirely opposite things. And as I have, most physicians will likely be aware that methemoglobinemia, a condition where oxygen cannot be efficiently transported by hemoglobin,
Usually like
the
carbon monoxide poisoning type thing.
the main way to treat this, the only way that we have to treat this is by administering intravenously methylene blue, and methylene blue will then essentially compete for oxygen and in the process of doing that will displace whatever is occupying that heme part of the hemoglobin that is blocked from binding to oxygen, which is usually uh, a toxin like cyanide or acid or
Yeah.
nitrates. And but what I'm saying is that if you give a larger concentration of methylene blue, then the methylene blue will produce methemoglobinemia because it will occupy that site, and it will not, if it is a
Yeah.
higher concentration, it will not let then oxygen to occupy the site. So it's not just simply going to displace uh, the uh, the toxin, the poison. Uh, so just like many compounds, methylene blue then becomes a poison. So the
Right.
poison is in the dose,
Right. That's always the key. The,
and so it is erroneous for people to say methylene blue does this, methylene blue does that. You always have to say, you know, a low dose, a low concentration of methylene blue under this condition does this. Because even in the most common application for methemoglobinemia, it can both be the only cure that we have and it can cause methemoglobinemia depending on the dose.
yes. Well, so that's interesting. So, like every med student, medical resident basically understands that, methylene blue, if somebody comes in with poisoning, hemoglobin, like carbon monoxide poisoning is the big one. That's the answer on the board question in the emergency room. That's what we give them. But what's interesting is after I learned about methylene blue, we started to look around for where do we get methylene blue. So, like you sort of lay out the history, it's very old. It sort of worked its way in before FDA was really regulating anything, and but it's also actually very difficult to find methylene blue. I was wondering if you could talk about that a little bit.
Well, this is a relatively new phenomenon, and there may be a number of reasons for this, but the in what I've been able to gather, I never had any problem when I was doing these studies finding sources for methylene blue, and still have significant amounts in my lab for research purposes. And however, what happened during these times that I've been researching these, what had happened is that we developed these selective serotonin reuptake inhibitor drugs as antidepressants. At some point, they became the most prescribed medications in the United
Hmm.
States. Uh, and what happens is there is a big profit that comes from having the most prescribed medication in the United
Yes.
States. And Methylene blue acted as an antidepressant. If you were to use methylene blue for these other situations, you will be having an
Yeah.
effect that can rival the effect of
Mm,
these
can just explain that. Yeah.
SSRIs, and this became a threat. So, what was the consequence? The consequence was that literally some people, let me just put it that way, were recruited to find what can we find wrong with methylene
Yeah.
blue that we can try to sound an alarm
Get it off the market somehow. Scare.
to
Put a
get
little.
it out of the picture, to get the competition off. By the way, this happened with photobiomodulation that it was used for pain relief, which was the first FDA-approved application of photobiomodulation. Was for a laser therapy, was for pain relief, FDA-approved in a number of conditions. And the opioid manufacturing companies managed to buy out, and I witnessed this firsthand, laser device companies, and then retreat this intervention from the market so they could continue to sell opioids, which now have become probably the most prescribed drugs.
Unbelievable. So literally, it's hard to even think about a conspiracy, but it's just business.
So with methylene blue, the same thing happened. And so what happens if people are taking the SSRIs, uh, and they also start taking methylene blue, not in those doses that you told me, this is the doses that you were telling me, but anyway, it is possible that the methylene blue will facilitate serotonin increases in the circulation. And the reason that this pharmacology slash toxicology, actually is one person that was hired by this company to do these things, has sounded the alarm. He's focused on the action of methylene blue on these tissue oxidases that I told you, including
Yeah.
monoamine oxidase, MAO. And if you have the right concentration of methylene blue, you can stimulate or inhibit any tissue oxidase, including monoamine oxidase. So he came up with the idea that the reason this was happening was that there was an inhibition of monoamine oxidase, and this resulted in more monoamines being available, including serotonin, and therefore a likelihood of serotonin syndrome, that is excess amount of serotonin that can lead to negative side effects happening. However, that has only been seen in individuals who had parathyroid disease that led to surgery to remove those parathyroids, where those individuals were anesthetized, the parathyroids exposed, and then methylene blue was directly used to bathe on top of the tissues in the neck. Why they do this? Surgeons, neck surgeons, do this because the parathyroids are embedded in fat. You can tell them apart from the fat and some of the other elements there. You can have some lymphatic nodes and so on. So if they bath methylene blue on just from the bottle on top of the open wound, the parathyroids, the abnormal parathyroid would be the most active tissues there. So then they flush it and they see the parathyroids will be stained, and then they remove that tissue and repeat, and they repeat this several times until there is no more of this tissue that is staying so that's how they accomplish the surgery. And this has been done, by the way, for decades, that type of surgery in that way. What changed in the equation was that now they were letting people go through these procedures taking their
Uh,
SSRIs, their antidepressant medications. And then that combination is what led in some of these people, several of them around the world, to develop signs of a
so
serotonin syndrome, which could be reversed right away by just stopping their
yeah. So
serotonergic
let me clarify,
drugs.
because this is a really
Uh,
important point. So basically, you're saying methylene blue, especially at lower doses, which some people, like to you, Dr. Gonzalez-Lima, like what you would consider lower doses. But I mean, it might sound like a reasonable dose, but certainly not the doses that people are getting injected IV necessarily. But and and but there was an FDA warning issued in with
correct.
combining them with certain antidepressants known as SSRIs, and and
Hmm.
and that sort of really led to some of the stuff being less and less available, in addition to the things that you explained before. And
Correct.
really, the only problem that led to the FDA warning was I think it was like 5 cases in 10 years or something, that all the patients that had this
That's
issue, serious serotonin syndrome, which is a serious thing. I don't want to give anybody a misimpression that
correct.
serotonin syndrome is not a very serious thing, but it was all patients that were getting their parathyroid surgically removed and were on these medications. So that's
Yes.
amazing. And now it's very hard for a doctor like me to get a high quality or any kind of quality, pharmaceutical grade quality for sure. Um,
Yeah, because companies are
yeah.
afraid of liability. And physicians also will be afraid because they see this label
Yeah.
that has this warning. However, I can tell you the first ones to put a warning were the Canadians, but they did it the right way. They say under these
Yes.
specific conditions there is this possibility that this will happen. It doesn't happen in the majority of cases. This is what happened. And so what they say was a fix was do not have them be on the antidepressant or any other serotonergic drug while you do that acute
Yes.
surgical procedure, because methylene blue was going to be there on board only
Yes.
during that procedure. And unfortunately, the procedure is such that you cannot really control well what is the amount of methylene blue that is really getting into the
Right.
circulation and becoming systemic because of the being an open wound that you are irrigating. So this but then the U.S. FDA came up with this more generic kind of a warning, and not under those conditions, but in any condition that there be a serotonergic drug on board, methylene blue should not be put on board, and this is what led to this overreaction by the
Right.
manufacturers. And by the way, I have to tell you, as soon as they came around, the group of surgeons, anesthesiologists, and pharmacologists at Mayo Clinic wrote a rebuttal to the FDA in which they reviewed the exact same data that was available to the FDA, and they concluded that in the way the procedure is usually done, or they should be done in this parathyroid surgery, there is no risk from serotonin syndrome because the amount of methylene blue that are used are very small.
Well,
Uh, and they analyze the same data set and arrive at the opposite recommendation. And so that's that's the scientific
unbelievable. Yeah.
evidence versus
So
uh, the government
I really appreciate your time. I
warning.
think it's probably a good place to halt. I mean, we could go on and on. I know you could go on and on. It's amazing depth of knowledge here. I think this is it's just one of these promising therapeutics, something that people can get. I use this Health Natura Simply Methylene Blue. It's people can access this themselves. Although you got to really be doing quality checks if you don't have a pharmaceutical grade product. But very, very interesting. I so much appreciate your time and willingness to talk to us and our audience.
Well, thanks to you, Nate, and keep up the good work.
Thank you. So that's our episode. I hope it was useful to you. Check out the show notes on iTunes or on our website where we've summarized the key points. If you find the information here valuable, please consider giving us a 5-star rating on iTunes and leaving comments in the comments section. It will really help us bring this message to as many people as we can. If you have questions or comments, connect with us on social media. Finally, to support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show. That's Patreon, Patreon, patreon.com/evolvingpast. Thanks, and talk to you next time.